Good afternoon. My name is Nikita Rumyantsev. I am head of Analytical Center of Moscow Urban Forum, and I greet you at our panel Environment and Health Challenges Cities Face. I will be a moderator, technical moderator. Let me introduce our dear guest and expert, Boris Revich. Hello. Yes, Nikita, good afternoon. Well, his background is very extensive, so I will read the Nobel Prize laureate as part of a group of international experts for climate change, head of Laboratory of Forecasting of Environmental Quality and Health of the Population Institute of Economic Forecasting of the Russian Academy of Sciences. He is the author of many publications, including textbook Environmental Epidemiology, and then Living in a Megacity. It's a very interesting book. We are going to speak about urban health and the way the environment in the city affects health of a citizen. I would ask to show the presentation, and after that, the floor is yours. Nikita, thank you very much. Before we start, I would like to thank the organizers of Urban Forum for invitation. I participated in all previous forums, and I saw the gradual changes in tackling the health problem from the first forums, and now there is more and more impact and great emphasis. We hear more and more this topic is mentioned, and more conversation what is to be done in Moscow to improve the health of Moscow population. And this initiative, I don't know who started about new complexes. I guess it was a joint work with Rospotrebnadzor, generalization of world best practices. And Nikita, you mentioned the book published by our group of scientists, quite young specialists who worked studying best world practices, what is being done in the area of urban health. And speaking about the improvement of urban health, you have to keep in mind that what it is, what are the features of this urban health in our country. First slide, please.
I understand that I start from not so pleasant slides when I'm talking about death rate, but in fact it is the most reliable index of health, and you hear about it from everywhere when we are discussing questions related to the COVID-19 pandemic. And unfortunately, the situation in this country, in Russian megalopolises, is not ideal. Moscow is approaching the results of such biggest megalopolises as New York, London, and others. And you can find more details in our monography. Nikita has told about it. Please show the second chart. Well, what is characteristic for our megalopolises? Unfortunately, it is a very high percentage of death rate because of car accidents. And here we see questions related to the planning and the organization of road traffic. They play a very important role. And also the psychological factor is very important. The fact if our drivers can behave themselves in a correct way, how they behave themselves towards pedestrians. And we have done a lot in Moscow. For example, we have changed the road arrows, or for example, we have changed some pedestrian crossings. You can see it on the square of Belaruski rail station. You see that the death rate was very high before. Afterwards, it went down, but we still lag behind some foreign megalopolises, and this is very sad. I suggest we skip the slide number 4 and number 5 because we do not have a lot of time, and from the other hand, there were some very different and very interesting events which happened those last days. You can see on slide number 6 the death rate in cities with the highest levels of air pollution. When we are talking about urban health and risks for health because of air pollution, we need to understand that such an industrialization from the USSR and construction of big plants, big fabrics led to a very high level of air pollution. A lot of years ago, I started to work as a doctor in a sanitary epidemiologic institution, and I was analyzing reports related to general layouts in Moscow and the situation of different industrial plants. A lot of time has passed, but you see that this strategy of replacement of such big industrial plants as ZIL or other industrial plants led to the fact that the air in Moscow became purer. But unfortunately, there are quite a lot of big or not so big cities with big industrial plants with a lot of emissions. They continue to influence in a considerable manner the death rate. To some extent, it can be related to an unsuccessful, unfortunate situation of those cities, as is the case for the city of Chita. Because of its geographical situation, whatever you do, the air still will be polluted. So we need to find some innovative solutions, and we can do this only with cooperation with meteorological services and other experts. Maybe we need to replace the dwellings to some other regions or districts. At the era of the USSR, I've worked in a small city of La Verda in Armenia, where the air pollution was very high, and we decided to replace the dwellings upper in the mountains. There were some places on a plateau where we could put those dwellings. And now in Russia, in the framework of the national project called Ecology, we are implementing another project called Pure Air. You can see some information about this project on the slide, and we hope that the situation will improve. But My opinion is that we need to invite scientific community, which is not um, working a lot for this project. There are some questions related to car traffic, and in Moscow, the Department of Transport, in cooperation with the highest School of Economics and also Moscow Road Institute and our scientific team, finally we had very interesting results for some 20 sites in Moscow, and we've seen that a correct traffic policy in the city, and also I understand that a lot of Muscovites are unhappy with this policy because they are stuck in traffic jams. But well, unfortunately, this is our reality, and we are paying for the decision to build Moscow in such a way that we cannot go rapidly to some high roads, highways, which leads out from the city. And the construction of a great number of roads and bridges, this is the right decision to reduce the number of car accidents and also to improve the quality of air. We see it not from newspaper articles, but we see it in the results of scientific research. And when we assess risks for health, we can say that for those 20 sites we have analyzed, in comparison with 2011, the health risks were reduced by 13%. For such a big megalopolis, it is a good result. And we also need to understand the influence of urban planning, and we understand that the minimum risk is very difficult to have only if we will have a lot of automated cars, and if we embrace the same path that is embraced by European countries. If we will have a lot of electric cars, maybe we will be able to reduce it considerably. This slide was prepared not so long ago, but today I can say that it contains some serious mistakes, and I've learned about it some 2 days ago. You know that there are certain criteria which are quantitative criteria. And first of all, it is air pollution. We have conducted such research in the USSR long ago. Afterwards, unfortunately, we stopped carrying out so many studies in this sphere, but we still know how to do this. But if we talk about some planning decisions, we can say that they were taken on the basis of common sense and maybe some unregularly studies. And now I'm approaching a very big problem, which was underestimated earlier. This is the influence of open spaces and green infrastructure on health. You can see on the screen that green spaces, this is at the bottom of the screen, green spaces, together with some other criteria, well, I was certain that we do not have tools in this country which can enable us to evaluate the influence of green spaces on health. And in fact, this is not true. And the European Bureau of the WHO has already created such a tool. And during several days, on the initiative of the Department of Nature in Moscow, a seminar is carrying out with the presentation of a brand new product which enable us to assess the influence of green spaces on health. And there are different criteria. For example, one of the very important element is the bronchial asthma. Bronchial asthma is a very important, very clear criteria which allows us to see what is the influence of air quality on health. We have conducted this work for Moscow, and we've defined certain elements which influenced the incidence of bronchial asthma among children. And now, with this new tool, we can assess the total territory of Moscow. This work won't be easy, but with the help of Moscow departments, the work will be carried out, understanding the influence of different elements, and we will be able to attract scientific teams which will be able to cope with it. And the Moscow State University will help us, and I think that this is a very good plan for works during the following years. Why are green spaces so important for megalopolises? This is because reduced mobility leads not only to worse physical condition, but also it decreases the quality of mental condition. And also we do not understand now what will be the consequences of the pandemic. And when we were not able to go to the nearest shop without a QR code, and you can imagine that a lot of people in Moscow are living in very small apartments, well, small in comparison with other European cities. And we understand that it has a very big significance and importance, this limitation of contacts with children, grandchildren, etc. And green spaces or spaces for physical activity which are publicly accessible and which were created in Moscow parks, in Sokolniki, in Bitsa, etc. They should be accessible by 15-minute walk. So in 15 minutes, we need to be able to walk to this space for physical activity. And also the level of solar radiation, the level of exposure to the sunlight is very important. That's why we need to have quite a lot of benches to sit on. And the department which is coping with the urban design in Moscow, they are trying to find spaces where they can plant a certain number of trees and create a certain number of benches for people to sit on them. Next slide, please. Here I wanted to show what are our losses caused by air pollution. Next slide, please. I've already talked about this. Next slide, please, with the diagram. Yes, thank you. So this diagram shows the climate influence. This is a very important index. Moscow lost 11,000. Well, 11,000, this is the excess number of deaths during the hot weather in 2010. Now, this number of excess deaths is a little bit less than the number of excess rates caused by the pandemic. And this slide was developed by our colleagues from the Moscow State University, and it shows that if we do not add green spaces in the central part of Moscow, the consequences will be very negative from the point of view of the population health. We can see on this slide the influence of COVID-19 and first works of our colleagues from Harvard, from Italy, showed the number of additional deaths caused by COVID. You can see the examples of Milano. They were able to create this curb, and I think that very soon we will learn more about the influence of COVID and the environment on health. And you know, a very interesting conference was organized in the Moscow State University, which was devoted to the environment and COVID. This was very interesting. Well, I will wrap up and now we will switch to questions and answers. Thank you very much, Boris. You have talked about very interesting questions. We have, unfortunately, only 2 minutes left. That's why I will ask only one question. What 3 or 4 most important lessons you can quote, lessons from the pandemic? Yes, you know, it is open spaces, also not to have closed dwelling districts where we see the creation of a polluted air. Also, we need to have a maximum quantity of open spaces and green spaces. What we see now, from the point of view of remoteness of our workplaces, changes our attitude towards construction of different buildings. For example, during the plenary session, the experts were talking about suburban construction, suburban planning. I think that this is one of the directions of development for Russian experts. We need to have more sunlight, more open spaces, more green spaces. Today, a lot of people use the vitamin, well, the hormone D, which is very important for our health and which can improve our immunity response. Thank you very much, Boris. Unfortunately, we have to wrap up. I thank you for a very interesting presentation. Thank you.